But the success of this is going to be achieved if we continue to adhere to the practice of social distancing. And so whatever we're trying to do, and again, we're going to talk about this collaboration, this is going to work, I believe, if and only if the people of our community continue to do the social distancing that's so important. So what we're doing today is we're going to talk in depth about the alternative facility at State Fair Park, or as I like to describe it, as the insurance policy. And this is what I mean when I say insurance policy. What we're going to be talking about today is an alternative care facility that will house 700 plus individuals potentially. It is my sincere hope that there's never a single patient in this facility. It is my hope that we're able not only to flatten the curve, but able to quash and squash the curve so that we never get to the point where our hospital system is so congested that we're going to need this facility. But just as many people buy an insurance policy for their house or their car, you buy it with the hopes that you never, ever, ever have to use it. And that's what we're doing here. We are hoping that you can criticize us 2, 3, 4 weeks from now and saying, well, you shouldn't have done that. It's our collective judgment, however, that it is imperative that rather than face a scenario where a week or 2 weeks or 3 weeks from now, we are here explaining why we don't have enough hospital beds or alternative care beds, that it is more prudent for us to make this investment so that we will be ready in the event. And again, I hope that we're all wrong. We hope that the modeling's wrong. We hope that the social distancing is working and that we don't have to use this facility. But that's a gamble with some pretty high stakes. And I don't think any of us who are working together to make this a reality want to take that gamble. So I want to thank the county executive. I want to thank the state of Wisconsin. I want to thank our congressional delegation because ultimately what we're doing is we're using some of the money that came from the CARES Act through the state to set up this operation. We also have with us Colonel Aaron Reisinger from the Army Corps of Engineers. And to just put this in a little perspective, the way this has worked is, again, the city and the county working together along with the city of West Allis. And I want to thank Mayor Dan Devine and give him a special shout out because the facility obviously is physically located in the city of West Allis, but he has been very quick to jump and say, we are part of the solution. We are going to be part of the solution. We've worked together, examined different facilities, and decided this facility was the best suited. We've worked with the hospitals, and I want to thank all the hospital systems for coming to the table and working collaboratively with us. And as we asked them, we said, look, you're in a much better position than we are to determine who should run this. And so what they did is they came back with a team, and it's a very, very, very well-experienced team that has come together in order to move us forward with this. The next step we took was we actually had a conference with Dr. Nick Turkle, and that name might be familiar to some people because until recently he was the CEO of Aurora, but he is now essentially the person who's setting up McCormick Place in Chicago for Chicago's alternative care facility. And he was very helpful with the medical team that we've assembled here to talk about some of the logistics. But again, this has all happened because of collaboration, cooperation, and communication. And I think that that's what, particularly in a crisis, what you want to see happen. And so I'm very pleased that at the local level, the state level, the national level, we've been able to work together to get where we are right now. So with that, I'm going to turn it over to County Executive Abley, who obviously has been very involved in this as well. County Executive Abley.
Yeah, thanks, Mr. Mayor. We have, and I want to echo a lot of what the mayor said. You saw the numbers again increase. We're at 1,560 confirmed cases and 68 deaths. And so every time you hear the mayor or I or anyone else talking about even making an improvement on slowing down the acceleration, nobody gets to take it any less seriously. We all hope to God that we don't have to use this facility. However, in elected office, if there is a 1% chance that a consequence of an action a decision we make could result in a death, we are not allowed. We cannot take that. We always have to, shoot for the absolute best, but be ready for the worst. And that's what we've got. But we're there because, as the mayor said, the collaboration has been awesome. I want to add my thanks to both Mayor Devine, the governor, and certainly Colonel Reisinger and his crew. Logistics and the ability to get a lot done quickly is a skill that's often undervalued, but not in times like this. And I know the work that you've done isn't limited to here. It is having a profound impact on how this pandemic will impact lives across the country. So it matters. Again, as the mayor said, we have had a little bit of indication that what we're doing is working. But as I said yesterday, nobody should be thinking that means we take our foot off the gas. The other way around, we should be thinking, let's not just flatten the curve. As the mayor said, let's crush this curve. And the way we do it is we double down. That means get even more serious, remind people who seem to have forgotten, politely, of course, and while socially distanced. But stay home, save lives. There's going to be a light at the end of this tunnel. How soon we get there and how bright it is entirely up to us. And everybody who's been working together, and it's been a great group, is working very hard to make sure it's soon. In terms of funding, also, we've been in touch with a lot of the Wisconsin delegation in Washington. Just today, we saw the first version of the fourth package. And there's a lot to keep track of, but suffice it to say that one thing that the mayor, myself, the governor, and everybody involved agree, we are going to also fight extremely hard to make sure that we get every dime of support that we're going to need to stay, to both deal with the costs here and stay resilient and emerge resilient on the other side. So with that, I'll pass it on to Dr. Weston.
Yes, thank you, County Executive. So as Executive Abele mentioned, we have seen 1,560 confirmed cases today and 68 individuals who have died. We talked yesterday about the different projection models that we are looking at to better understand the impact and effects of COVID-19 on our community and what is to come. The take-home messages from those models, despite their differences, was twofold. First, and most importantly for the public, is the importance of social distancing. Every model is highly dependent on strictness and adherence to social distancing from the public. It's a very simple relationship in that the better we do at staying home, the less people get sick, the less people die, and the faster we're able to get past this epidemic and back to a more normal life. Second, and most important for planning purposes, is the understanding that in light of the variation in these models in predicting needs for hospital beds, ICU beds, and ventilators, as well as when we hit a peak, now even more unpredictable after the congregating event at the polls 2 days ago, it's critical for us to hope for the best, but as the mayor and the county executive mentioned, be prepared for whatever may come. And so with that in mind, as I've mentioned before, all of the hospital systems in Milwaukee County are working together like never before to share resources, share information, and share best practices to plan for a potential surge yet to come, and to best ensure that they can care for our citizens in need. As part of that planning, we've worked to create a phased approach to an increased number of patient care abilities. So this ranges from the first phase of hospitals at baseline resource status to ramping up to maximize clinical and then non-clinical spaces. And through these efforts, our hospital systems have managed to increase the number of Milwaukee County standard inpatient floor hospital beds from about 2,400 at baseline up to nearly 3,600. And that's an almost 50% increase. Likewise, they've increased the number of ICU beds from a baseline of 450 to nearly 900, an almost 100% increase. And as I mentioned yesterday, countywide, we also have about 500 ventilators for patient use. These capacity values and where we stand on hospital resource use are obviously important for decision makers to use in determining next steps. But they're also valuable for the public to know, to understand where we are as a community and what we are doing to address patient needs. So in discussion with our hospital systems, they're in full agreement and fully committed to being publicly transparent with this information on a day-to-day basis. So we're working to integrate these numbers, this information, and these trends into a publicly available daily dashboard that will be available soon. Expanding our hospital capacity is critical for preparing for a potential surge in COVID-affected patients. However, we, the county, the city, the municipalities, are working to be proactive and plan for this alternate care facility in case we need to move beyond the traditional hospital environment. We hope, as everybody has said, never to have to use it, but we would rather be prudent and have it available and not used than to find ourselves unprepared with patients in need and nowhere for them to go. And our upcoming speakers will provide more information on that front as well. And now I will hand it off to my public health colleague, Darren Rausch. Thank you very much and stay safe.
Thanks, Dr. Weston. It is my pleasure to join today as the representative from the 11 health departments in Milwaukee County. As mentioned earlier in the week, this is National Public Health Week, and the spotlight has certainly been on public health and our partners throughout the community working to control COVID-19 in the greater Milwaukee area. This week is also an important week in many religious communities. For many of us, it will be strange to not be worshiping this weekend as in prior years. It will be strange and difficult that we're unable to spend time with extended family, friends, and others this weekend. Today, the governor's office clarified options available for religious gatherings and services that comply with the Safer at Home order. The underlying message of the clarification document is that we must continue to perform physical distancing under the Safer at Home order to stop further spread of COVID-19. Anecdotally, as the lead public health official in my extended family, I canceled the Rausch family Easter several weeks ago. This was not an easy decision, but it was a necessary decision. While there will be no in-person family gathering this weekend, we will connect by phone, FaceTime, and other virtual methods. As a family, we agreed that we'd rather hold a later Easter holiday celebration in June or July than to potentially spread disease and put older, more vulnerable family members at risk of COVID-19. Lastly, I wish you all a healthy holiday week. Be sure to connect with your family and friends this weekend. Even though you cannot be with them physically, it is important to make a connection. Only through a stay home to save lives mindset can we lessen the impact on our healthcare system while lessening the need for the alternate care facility addressed on this press conference already and that Colonel Reisinger from the U.S. Army Corps of Engineers will discuss next. Colonel?
I think you're muted, Colonel.
Yeah, Colonel, you're on mute, please, if you could look for your mute button. While we're waiting for that, I just want to remind journalists who are on the call that if you have questions, please feel free to type your questions into the chat window, and I will read those questions in the order that they're received. And Colonel Reisinger, it looks like we have you now. Go ahead.
Yeah, I want to, again, thanks, Darren, for the introduction, and Mayor Barrett, appreciate the opportunity to be with everyone today. Again, I'm Colonel Aaron Reisinger, the commander of the Chicago District, U.S. Army Corps of Engineers. And our district, there's 43 districts in the United States and overseas, and my district has jurisdiction over most of eastern Wisconsin, northeastern Illinois, and northern Indiana as part of the Lake Michigan watershed area. First and foremost, it's a real honor to be a participant in the team that's been assembled up there to address this challenge. And I would echo, Mayor, what you said. You know, I've been in the military business for 26 years now, and that is, we spend every day preparing to do things we hope we never have to do. And that's really just an extension of what we're doing here today is creating capacity that we hope is never used, but if it's needed, it's available as an option to the healthcare community and to the leaders in your community. I think insurance, what we believe, what I've communicated to my team is we're in the confidence building business right now. And that's what really insurance does. It's confidence that we have the capacity to deal with unforeseen circumstances. We have built confidence in our healthcare workers that we have constructed facilities that are safe and effective and valuable to them. We have confidence that for the patients that if they are seen and are being cared for in one of these alternate care facilities, that they'll have really top-notch facility support. And then also confidence in our workers and the team that are being assembled in what we're doing here to deliver these products, that they have a safe environment to work in. So we're honored to be a part of it. I would first and foremost just echo, everything here is a partnership, and we work in really close partnership with FEMA Region 5 in this entire area. Our authorities and our funding come directly from FEMA through their mission assignments. We received the mission assignment for the alternate care facility in Wisconsin on Tuesday evening. We awarded a contract that night, actually, to Gilbane Construction Company, who has a significant presence in Milwaukee. And then we mobilized. So we awarded a contract late Tuesday night, and we mobilized for our first meeting at 8 a.m. Yesterday morning with an entire team of medical professionals, facility managers, contracting team that came together yesterday at State Fair Park at the Expo Center to kick this off. Gilbane Company came in and they shot right. I mean, it was like shot out of a cannon with incredible capacity. Local subcontractors that came on board and started planning. We had a second meeting today, so we're just a little over 24 hours in at this point. Still working through final scope, design, reviewing some of the specific specifications, technical challenges that we have to work through to continue to move forward on this project. But I would say incredible confidence with Gilbane Company, the State Fair Park, the fire, the police, the medical professionals, the entire team that's been assembled there to get after this problem. So I'm very confident that we have all the people, all the skills, all the resources we need to provide a facility that Dr. Weston and Darren were talking about, to provide those relief valves to the local healthcare network if it's needed. And again, we're excited to be part of the team and see this one through and partner with everybody up there. So I'm going to turn it over to Mayor Devine of West Allis. Sir, I thank you for your hospitality. It's been great to be with the team up there for the last couple of days.
Well, good afternoon. Thank you, Colonel Reisinger. I appreciate that. I'm here today really wearing two hats. I'm as obviously the mayor of the city of West Allis, but also as a member of the State Fair Park Board. And I can tell you, as leader of the community, as a member of the board, we're both very happy that we can be a part of this solution in a regional approach, because we realize that if we do need this facility, this is going to be overflow from hospitals all over the region. And it's really not even just a Milwaukee County situation. It could be Oconomowoc, it could be Brookfield, it could be Racine. As these hospitals get more and more patients coming in, we are very happy that we can be part of this solution and nip this thing. Our fire department, our police department, our community leaders have been in contact with the operation with the Army Corps, and we appreciate their efforts. We appreciate their outreach, and I'm just comfortable and confident that this is going to have such a minimal impact on the neighborhoods. It's directly next to the freeway. It is a central location, and my hope is that everything you hear about in the news is going to be the only thing you hear about and see in your neighborhood if you live in this vicinity.